There are particular kinds of iterations or images given to the very sensitive subject of end of life, and they tend to largely fall within a certain kind of aesthetic, and really kind of shine a light on how we feel about giving images to end of life, and how we feel about looking at and seeing death and the moment of death.
I think this was taken in about 1981, I think this is the first picture of a hand holding another hand in a hospice. It's a cliche now, isn't it? You know, you see this everywhere when somebody's, you know, writing a palliative care article.
There's a rather limited flock of images available to the policy conversation, the public discourse in thinking about the end of life. And if our imagination is resourced by only this limited set of images, well, then that's going to direct us down certain paths. One consequence, practical consequence, is that there might be difficulties as clinicians, patients and families try to match expectations with one another.
Critics of this idea of total pain warn that it can potentially produce the normative idea of a good death, which patients and caregivers can feel burdened rather than sustained by.
Do we somehow idealize death and dying? Do we somehow have a vision of perfection that actually can't really be achieved? And the reason it can't be achieved is because it is rarely something to be celebrated. It's usually a tough event. Now, death and dying is one area where it is incredibly difficult to think about measurement without reducing it to something that is meaningless. And that's the real challenge that we face now. And that, in a way, is even more, the reason why it's even more important that we have forums like this, that we actually talk about it across disciplines, with the benefit of people who look at it through different lenses.
The post-9/11 culture of intrusive vision and scrutiny that Anderson exposes in this film is intertwined with a study of vision of a far more sensitive and empathetic kind, an attempt to see what others see, to feel what they feel.
We've used films a lot, and as I said, I didn't realise until I started doing this, lots of different films. We're actually launching a film, as I mentioned, tomorrow, which is based on a couple who, Seth and Leslie, and Seth actually, he was diagnosed with pancreatic cancer, he was just about 50, and he died within 33 days of diagnosis, which is really sad because it sort of happened so quickly. But what Leslie's done is she shared her story, we've turned it into a play, into a film, and we've got lots of great resources around it, because actually what she's saying is the little things make the difference.
And of course we know one reason why there's disparities between clinical practice and what popular media might show is because end-of-life care raises many issues which are hard to find ways to feel, think and talk about. So it's easier to just have a limited span of images. But this rather results in a tendency to short-circuit the process of thinking in this area.
How popular image and language really affects the context in which we approach people with cancer. So trying to explain complexity, particularly at the times of real emotion, if cancer has come back or if your last treatment hasn't worked, these things are really difficult, again, if the images and the language and everything surrounding you is really binary.
I really wanted to, I suppose, let's see there was a way that other people could have an insight into what I had been frightened of, and I guess many people were, and that was what might it be like to be living with that knowledge of death, and with your relatives to also know what would that be like, and is there any way that by absolutely not sugaring the pill, as it were, and the hospital was very keen that I shouldn't, could you make an honest portrayal that would actually be something that would be useful, I suppose, in some way helpful?
The real cost in dealing with people at the end of life is it's one naked human being dealing with another naked human being, and there's nothing left to give, that's a very painful experience, a very costly one. But actually, it's where many families find themselves and where we often find ourselves with patients. And the vulnerability and the cost of that is quite excessive at times.
Early in this series, introducing Be We, Robbie referred to the end-of-life and palliative care framework, and again I'm speaking about things that you are much more familiar with than I am, and its 6 person-centred ambitions, and Robbie argued beautifully for the links between these ambitions and the potential of film as medium, that films might open questions about attitudes to dying, answering the important questions that Stephen raises in the paper I opened with, that films might yield access to feelings, to a new knowledge, particularly for those who, like medical students, are trying to develop a sensitive awareness of the needs of the dying and their families.
I'm a GP in a prison, and we have a lot of patients who die. And what really struck me from the film clips that you showed were how therapeutic just being with that patient was.
As doctors, and maybe as other healthcare professionals, we're incurable people in terms of trying to fix things. And so when it comes to prognosis, we hate saying we don't know, which is often, or we're very uncertain. And then when people start articulating these existential issues, we kind of feel we've got to give an answer. Whereas actually, as you were saying, Derek, that's not the message at that point. It is to validate what do you say to Kevin when he's losing 2 small children? The answer is there's nothing to say, but to validate the sadness that he is expressing.
I'm now working in palliative care. I was just really intrigued, and this might be a bit provocative, but you mentioned that the film included filming the gentleman's death, but he chose not to include that. And when we talk about how difficult it is to talk openly about dying and death and even use those words with our patients, and so many people, medical students, families have never seen someone die, I guess I'm just wondering if you know why he chose not to include that, whether we would feel ethically comfortable with including that.
I did ask him that question, and he later on in the film, you see the funeral and there is an open coffin, so you see him, you see his dead body, and he said that he, when filming that scene, because he was filming it by himself, he was doing the camera work because he felt it was too intrusive otherwise, and he felt himself that he was too emotionally overcome to show it in the film, and that in a way he needed these images of landscapes in between to in a way delineate that process that does not belong to the viewer. It belongs to the caretakers, caregivers, and to the patient at that very moment.
It really accurately captures something that it's very easy to lose clinically. So the 2 words in my mind are a silent witness and privilege.